I went to University of Pennsylvania for veterinary school. I went on to practice in Chicago, a little bit in Maryland, a little bit in Rhode Island, where I actually had my own practice, and then decided to move to San Francisco. And I did some relief work initially, and I've been at Opitz Hospital for the last 6 years.
My name is Megan Moser. I was a technician for 8 years and then went to veterinary school and have been practicing for 11 years. I currently work at Mission Pet Hospital over at Valencia and 18th. And so I've been predominantly working emergency work and now day practice.
Oh wow, that's really impressive.
Yeah.
Any abnormally growing cell you can think of is in a way sometimes can lead to cancer. We normally see cancer in pets show up in many different ways.
It really depends on what type of cancer they have. I would say that we see a lot of skin tumors in dogs, which is something that a lot of people can notice on their own while they're petting their dog. In cats, we see probably more internal types of cancers, also obviously internal cancers that affect dogs. So there's quite a few of them. Some are manageable, some are curable with surgery, especially a lot of the skin ones.
We actually do chemotherapy at Mission Pet too, so depending on the type of cancer and whether we can remove it surgically or then ultimately treat it with chemotherapy. There are definitely quite a bit of options as far as choices that people can make and the roads they decide to take.
Things that I recommend that people watch out for in their own pets are changes from the norm. So if the energy is down, if the appetite is low, if there's increases in thirst or urination, changes in mobility, limping or stiffness, anything like that. Persistent vomiting or diarrhea, persistent coughing or sneezing. So anything that is different from the norm, be aware of. Pet your dog and cat regularly. If you notice a lump or a bump, bring them in right away.
Sometimes you'll notice the color of the skin if it's yellow. Sometimes being icteric can mean some type of liver issue. But it can be as vague as just kind of weight loss or general lethargy, just not wanting to do normal activity. We normally tend to see it, in middle to older age dogs. Cats are a little bit harder. They seem to be very stoic in the sense of showing signs of sickness sometimes. So sometimes just, hanging in a different area or sleeping in an abnormal spot. Doing something really abnormal for a cat, peeing inappropriately, something of that nature. It's kind of their way to let us know that there could be something wrong also.
The sooner we can diagnose something, the better chance we have at managing it.
Yeah, absolutely.
Absolutely.
Coming from an environment of cigarette smoking, there is, a correlation with animals getting lung cancer from secondhand smoke. So, the things that we can do to prevent it would be, good quality diets, just general exercise if we can. Socialization too, so yeah, being active during the day, if you have the ability to, bring them to a place where they can hang out with other pets and be active all day outside in the fresh air. That's fantastic. Even something as short as a dog walker or, someone to come in and check. Cats are different, where I feel like their home is more of their comfort zone. Dogs in general tend to be kind of more of a social type of animal too. So, it's just like in humans too, keeping them engaged, keeping them, with other animals. And also the great thing about that is you get another set of eyes on your dog, you have someone coming to say, what, your dog Oscar is acting weird today at daycare. It's just another set of eyes to say, wow, maybe he's lost some weight and you haven't really noticed just because you're with him day to day. So that's another way that's kind of nice to be able to, sometimes when we're with them all the time, it's hard for us to judge.
Nutrition plays a big part, so feeding good quality food, well-balanced food is very important. Making sure that the pets get a lot of exercise, just like with us, whether it's taking them on hikes or putting them in a lot of places in the city, like Pet Camp, will offer daycare where dogs get to play with each other, which I think is really, really good because it's something that they would do in the wild, and they definitely get a lot of enjoyment out of it. So nutrition, exercise, and then preventative care. So actually going to the veterinarian, I recommend twice a year. You know, pets don't live as long as humans. We go to the doctor at least once a year, just for our preventative care, and I think the same thing should be with pets, but even better, I would recommend every 6 months, just developing a good relationship with your veterinarian to ensure that things are picked up early. You know, if you pick something up when it's very early on, before there's even symptoms, you have a much better chance of potentially curing or at least managing it much better versus catching it very, you know, later on. My pleasure.
All right, thanks.
Thank you.
Good one.
Yeah.